Hi, my name is Jeff Patterson. I'm the Chief Executive Officer for Nacogdoches Medical Center and the NMC Health Network. Today I'm welcoming Dr. Mike Randle to our first edition of NMC Ask a Nac Doc.
I am Mike Randle. I'm one of the neurosurgeons here in Nacogdoches, also Chief of Surgery at Nacogdoches Medical Centers.
You know, one of the things that's been so exciting about 2022 is getting ready to debut our NISC, or the Nacogdoches Institute of Spine Care. Would you like to talk more about that?
This is something that's kind of been on my radar for numerous years. I've worked with various CEOs, and Jeff has been the one that's actually brought it to the table and gotten it in the process now of putting everything together for an institute that will have any kind of problems with their back or their neck or anything that we can do from a neurosurgical standpoint. So I'm looking forward to it. We're putting it all together now for hopefully a premiere somewhere around January.
Can you kind of elaborate on kind of your vision for the holistic method?
I think a lot of people have the misconception that all I do is operate. That's not true. We go through a whole variety of different ways of trying to get rid of people's pain. Say, let's cut to the chase and go to the operating room. So we do a lot of physical therapy. We do a lot of injections thanks to some pain management doctors here in our area, and we have some very good ones. And we'll work you through the whole process and hopefully have at least a solution for your pain.
Well, I can speak on behalf of Nacogdoches Medical Center's physical therapy department. We've got a great group. You know, I've just been really impressed with how your team has been able to navigate that for people, because I think that's something that putting that patient into the Nacogdoches Institute of Spine Care allows y'all to really help navigate that for them.
The biggest, again, the misconception is you see my name on my board out front and it says neurosurgery. Well, that's just not the case. We do spend a lot of time accessing all the x-rays and all that sort of stuff, whether it's from medical center, from somewhere out of town, or wherever it is. Getting you into the system, for those who are listening to this, getting you into the system is the first part. Going through the system and with the physical therapy, with the pain management, the pain medication as you need it, and all the different aspects of that is what's really important. If we get to surgery, hey, we get to surgery, but that's the most important part, is getting you in the system, getting you down that pipeline. We won't run you around to 10 different people. We'll have it all right there in the Institute.
Thank you again for your time, Dr. Randle.
Pleasure.
Really appreciate you helping learn more about the Nacogdoches Institute of Spine Care, as well as talking about your practice and the care that we bring to the Deep East Texas community. Thank you all for joining us here for Ask a Nac Doc. Stay tuned for other relevant health issues that we'll bring to you in the near future. Y'all thanks and take care.